Welcome to Cradle and All, a podcast hosted by sisters Renita and Christine to educate, inspire, and connect with other mothers. Every other week, listen as we discuss topics related to pregnancy, raising children, and balancing motherhood with other aspects of womanhood. Whether you're relaxing, juggling tasks, or even breast pumping, join us as we figure it out together. Hi guys, welcome back to another episode of Cradle and All. We're back after a little bit of a break, so excited to be back talking to you guys today. Now this is your host Renita, and it's just me today, but don't you worry, Christine will be back here with our next episode. Now this week's episode is going to be a little different because it's me talking alone, but I'm talking about something that's so important for all mamas to know about and affects Black women in particular. The day this episode's released is Sunday, April 17th, and this is the last day of Black Maternal Health Week. So I really wanted to spend this time talking about pregnancy outcomes that may not be the same for all women, as well as ways to advocate for ourselves in pregnancy and how to prepare if any poor outcomes may be coming. So this all stems because of Black Maternal Health Week and really making sure that everyone knows what it is and can really know what to do about it. I never want to alarm people because there's so much going around about statistics and facts and some scary things that we talk about at a time that really should be really happy. But what I want to do is make sure that all women feel empowered when it comes to taking care of their health if things may go awry in their pregnancy. So what is Black Maternal Health Week and why are we even talking about it? This is the 5th anniversary of celebrating Black Maternal Health Week and really just using it as an opportunity to advocate for and continue a conversation about the disparities of health outcomes among Black women compared to other women when it comes to health. So an organization called Black Mamas Matter Alliance started this initiative as a way to encourage awareness, activism, and just community building regarding this issue, because it's going to be something that takes not just the patient, not just the doctor, but really a national conversation from legislature to grassroots to just individual ways to help improve these outcomes. So it all starts because there is a stark difference in the rates of maternal outcomes among Black women and other women. So the CDC does a really good job of kind of laying out these numbers if anyone's interested. And again, I don't want anyone to be alarmed or frightened thinking about this, but some of the staggering statistics show that about 700 women in the U.S. are going to die each year from a pregnancy-related death or complication from their delivery. So that's a big number because even one death is too much. All right, so what does maternal mortality mean? When we talk about that, we're talking about deaths for pregnant women or women who have had a baby 1 year after delivery. It can be any type of death. So let's look at the 2020 numbers. They look at rates based on 100,000 live births. When looking at Black women, that rate is 55 for every 100,000. That means in 2020, 55 for every 100,000 women who had a live birth died while pregnant or 1 year after pregnancy related to this. And it's because of something with the pregnancy. Now, taking a look at white women, this rate was 19 for every 100,000. I said that right. 55 for Black women, 19 for white women. And then looking at Hispanic women, that rate was 18 for every 100,000. So that's a large gap. That's why when you hear those rates, Black women can die at a rate 2 to 3 times higher than their white counterparts. This is where that comes from. I mean, it's 2022, people. That's crazy. So what are the most common causes or types of death? It's usually related to something like bleeding or hemorrhage, blood pressure related issues like that can lead to like stroke or cardiac problems. Those are kind of the things that you're usually seeing as the most common issues that relate to these type of deaths. So what does it mean and what do we do? You know, I am a physician, but I'm also a mom. I've also been a patient, and I've also been a patient with complications. So this is extremely frightening, especially when you are pregnant and wondering what could happen to you, or if you've been in a situation where things are, not what you think they're going to be when they become complicated. So the first thing is why? Why is it that these numbers are the way that they are? Why is there this disparity? It's important to realize that there are some underlying factors that may play a role. For example, access to care may be an issue. Underlying health disparities already. Black women may have higher risks of certain health conditions at start that may increase the risk of complications in pregnancy. But it is absolutely imperative that we all recognize that implicit bias and systemic racism in the healthcare system play an extraordinary important part in this as well. So there are things that we can do from the healthcare perspective as well as patients to better advocate for ourselves. So what my goal is for my patients who come to see me in the office, for my friends and family who are pregnant, and as a healthcare provider myself, is to work on all these fronts to help improve these numbers. So what can one do? What can you do? So let's talk about it from the standpoint as a patient. These are my 5 tips to help basically do your part to advocate for yourself to make sure that you feel safe and are taken care of in your pregnancy if you are in a situation where you may encounter implicit bias or systemic racism or just feel like you're not being heard. My number 1 advice is to find a healthcare provider that you trust. So trust is everything when you're going through any kind of healthcare situation, but especially in pregnancy, because there's a level of knowledge that you don't have there that is required for you to make sure that you are well taken care of. So knowing that somebody has your best interest in mind, as well as knowing that when it's an emergency situation and there's not enough time to have a conversation, that healthcare provider or that healthcare team is going to take the best care of you and take equal care of you that they would of anybody else is essential. So find a healthcare provider that you trust. I think that there are amazing providers out there, but it's almost like dating sometimes as to finding the right fit for you. I am somebody who asks a lot of questions when I go to see a provider. I want to make sure that they're being answered the way that that I completely understand. And so I try to do the same thing for my patients. And so it can take time to build that trust. So right at the beginning of your pregnancy or even prior to your pregnancy, when you know you're planning to get pregnant, meet with a doctor. And if that one's not the right fit for you, meet a couple more until you find that right one. When you get into the hospital setting to deliver your baby, talk with your nursing staff and the techs and everyone around you to let them know any concerns that you have and start to build that level of trust, because even though they're only going to be working with you for a few days or hours in the hospital setting, again, those are going to be important times. There are a lot of different faces that you see in the healthcare system. Your medical assistant and nurse and front desk staff at your doctor's office, midwife or doula that you may have. In the hospital setting, there are different types of nurses. There are techs, administration. So really, there can be a lot of faces and can be overwhelming, but please make sure to vocalize anything that's going to be important to you so that you can begin to build that trust and feel comfortable with those who are taking care of you. And if you feel like you're not feeling that situation, you're not feeling like you're in a situation you may trust somebody, it's okay to try again with somebody else. So how can you find providers that you trust? Word of mouth is great. Ask friends and family. getting reviews, reading reviews online is like the thing to do these days, because people can sometimes put about experiences they've had. So you may not know who's written the reviews, but if somebody else is recommending them and there's a list of great recommendations, that can speak volumes. So that's my number one piece of advice, is to find a provider you trust. So what do you do when you actually get to the appointment? Come prepared with questions. This is my tip number 2. So come to your appointments with questions, and lots of them. Come prepared to talk about what's worrying you. Come prepared to talk about what you need to know, but you don't even know what to ask. This is your opportunity to educate yourself and to talk about what to expect in the future of your pregnancy journey. No question is off limits. And no question is stupid or dumb or anything like that. So if you are like me and are forgetful when it comes to remembering what to ask when you get there, write your questions down in advance. Ask your partner or family members if they've got certain questions that they think you should ask that you can bring with you. What are some questions you should be asking at these appointments? For one, ask your doctor, what do they know about the disparities of health outcomes among Black women and other races, or whatever your race is, or whatever your background is, whatever your medical condition is. Ask them how they're going to be proactive in making sure that you're safe in pregnancy. Ask questions about the things that scare or worry you. I know this has been in the news a lot recently in the last few years, and I've even had a lot of patients come to me saying, I'm pregnant and I know I should be excited, but I don't want to die. I don't want to get hurt in pregnancy. I'm nervous. So tell that to your healthcare provider. Let them know, this is what worries me. What are we going to do to make sure that I'm safe? And should I be nervous at all? Another thing that you can ask, certain kind of questions you can ask, are what are the red flags or signs that you should look out for in order to make sure that if something is wrong, that you're taken care of immediately. The interesting thing about pregnancy is that there are a lot of new feelings. So cramping and pain, sometimes spotting or weird discharge, headaches, backaches, swelling. These are things that could mean nothing. They could just be normal pregnancy symptoms. But they can also be the signs of something brewing that gets worrisome. For people like me in the healthcare field who've trained for years and are aware of what this is, we know how to take the steps to distinguish what's worrisome and what's not. But it's important that you, as the mom to be, the patient, knows what are the red flags, what are the signs that this is more than something that's just a normal part of pregnancy. So that's a very important question to ask your provider when you're in your appointment. What are red flags I should know about? A little example of this, headaches. Super common in pregnancy. Sometimes people can get them in the first and second trimester, and you can take Tylenol or increase fluid hydration or eat little snacks to see if they can go away. But a persistent headache, not going away with Tylenol, that sometimes can be a little bit more worrisome for something like preeclampsia, which is one of the big blood pressure conditions we worry about in pregnancy. So it's important that you have this conversation with your provider to know what are the signs I need to be on the lookout for, so I can let you know that I'm worried or something could be going on, because you guys are a team. And so it's important that you know what's going on as a part of the team, that you know how to let your doctor know that, hey, something's off. So my third piece of advice is listen to your body. As I said, there's a lot of new changes. How you felt before pregnancy is completely different in pregnancy. I mean, some people have these beautiful pregnancies where it's like, oh, I'm just glowing, everything's great. If you're like me, everything felt off and weird, and I just never felt comfortable in my pregnancies because there was all these little aches and pains and discomfort. So everyone's body is different. And yes, there are a lot of things that are expected in pregnancy, normal pregnancy changes, but at the end of the day, you know your body best. So when something feels off, speak up. And if you feel like you're not being heard, speak speak up louder. So like I said, talk with your doctor, your midwife about what symptoms are normal from pregnancy and what could be an indication of something that could be a problem. But if push comes to shove and somebody's telling you, you know what, this is completely normal, and if you feel like it's not because you're listening to your body, speak up and say, I am concerned. I needed this to be evaluated. Because at the end of the day, if it is normal, if nothing's wrong and an evaluation's done, then that's great. We've ruled it out and all is well. But at the end of the day, you know your body best. You are the expert at your body. And so when in doubt, listen to it. Listen to your gut, listen to your body if you know that something's off. So my tip number 4 out of 5, have a support system. So it's a little bit different these days because with the pandemic, partners and family members aren't able to go to all doctor's appointments or to the hospital in itself. But the support system is really key in any setting of healthcare, especially in pregnancy. So that support system is somebody who can speak for you or help you and encourage you to speak up if you don't feel comfortable. They can help you craft questions for your appointment or even come up with questions if you forget. That person can help support you in labor by coaching you through pushing, or if you don't want to focus on anything other than going through the labor process, they can advocate for you and speak for you at those times, or they can do all of the above. So who is your support system? It's whoever you want. It could be your partner, your sister, your father, your mother, your doula, who is an amazing option. Doulas are so great because they are there to provide physical and emotional support during the labor process, during the pregnancy, even the postpartum period. And so, like I said, the pandemic is a bit different right now, but there are ways to have that support even if they're not able to be physically there. Thank goodness for technology. There is Zoom and FaceTime and all those things that you can have that person there. Again, crafting questions and talking before appointments if they're not actually able to be at that appointment with you. And as you prepare for labor and delivery, having a plan about what you want that experience to be like. An example of this, I've got some patients who have said, I don't want an epidural, I don't want pain medication, please don't offer it to me. And if I want it, my support person is going to be the one to tell you. I've had some very shy, nervous patients who don't feel comfortable speaking up, but they can have their support person there saying the things that they aren't able to say themselves. So make sure that you're surrounded by people who you know you can trust and who is going to be your village during any difficult times if things don't go as planned with the delivery, with the pregnancy process, and who are there to celebrate the good times as well. Have that support. All right, you guys, and my last piece of advice that I have, and I mean, it's just 5. I could go on and on, but I'm just giving 5 today. So my last piece of advice is don't be afraid to get a second opinion. Pregnancy is a little different than other times in our healthcare lives in that you're only pregnant for about 10 months. I know we say 9, but it's really 10. That's another topic. But anyway, so we're only pregnant for 10 months. So many times by the time you get started, the ball has gotten rolling with the test and the appointments and things like that. And sometimes you may not vibe with your doctor. You may not feel like that midwife is for you, but you're like, well, I've already started. I'm just going to keep going. Stop right there. If you don't feel like this provider's for you, it's okay to get a second opinion. It's okay to see somebody else. If you have a gut feeling that maybe I may not have the best trusting relationship with this person, I urge you to get a second opinion. It is possible. You can submit records to a new practice for what you've got on file. And the sooner you get a second opinion in the pregnancy, it's maybe a bit easier. But even if you are in the hospital and you feel like, you know what, I don't really feel like this is going well with this provider or this nurse or this healthcare team, ask for a second opinion. There always can be another group of physicians, a group of midwives, a different nursing staff or a nurse who can come in and provide another opinion or give a different perspectives. But trust is essential, and making sure that you are heard is key. So as a patient who's had complications, as a support person for family members who have gone through unfortunate healthcare situations where they were not heard and it has affected healthcare outcomes, these are the things that I think that we as patients can do to help advocate for ourselves in pregnancy or even when you're not pregnant. Now, there are things that healthcare providers can and need to do as well. As a healthcare provider myself, I've been lucky to train at some places that really spent time teaching me about recognizing my own implicit biases. And that's something that I urge all healthcare providers to do. Implicit bias is basically unrecognized biases, unrecognized times that you may make assumptions about other people. And it doesn't always have to be about race. It could be about age. It could be about socioeconomic status. It could be about education. It could be literally about anything. But sometimes you make assumptions. And so recognizing that other people's experiences may be different from you is really important, because when you're making medical decisions and caring for an individual, you have to understand that it may be a bit different than other patients that you may experience or your own experience. So I really urge any healthcare providers out there to recognize your own implicit biases. And honestly, as I said, I've been lucky to practice now at 2 institutions that really provided that training for me, both in medical school and residency. And I hope that that's something that continues to get taught on all levels of healthcare. Other things that healthcare providers can do is be proactive and talk to your patients about this kind of stuff. I cannot tell you how many times I have Black women come into my office saying, number one, it's hard to find a Black doctor. Like, I'm so happy I found you. But secondly, I wanted somebody who looks like me because I feel like you may understand me a little bit. I feel like I may be able to trust you. And I see it all the time. And to be honest, we've all probably been there a little bit. How many other women may seek out a female provider? Or sometimes when people feel comfortable talking about their experiences, when somebody else chimes in and says, oh, I've had that experience too, feel a level of comfort from that. And so it's not surprising that some people may look for that. But at the end of the day, as a provider who may not look like the person in front of them, whether you were a male provider or a white provider or a provider who's never had a baby themselves, at the end of the day, patients just want to feel like they can trust you and that they're going to be heard by you. So be proactive and say, you know what, I know this is an issue. I know this is something that our country needs to work on, but don't worry. You can trust me. Don't worry. I'm going to take care of you. And this is what we're going to do together to make sure that you're safe. So that's really important for all healthcare providers to do. And I really encourage everyone to be doing that. My other tip that I have for healthcare providers out there is just to listen. You know, the way our system is set up is that we've got these 15-minute appointments. We're in and out. Everyone's trying their best to see all the patients they can while doing notes and doing all these things. But sometimes patients end up feeling like they're just a number. And at the end of the day, we all just want to be heard and feel heard. So after discussing whatever medical condition or discussing whatever issues going on in the pregnancy, ask questions of your patient and say, you know, do you understand this? What do you think? What do you feel? Make sure that your patients are feeling heard. So, you know, I hope that this is stuff that's helpful for any healthcare providers out there, any patients out there who may be nervous or scared about the different numbers and the statistics, because I don't want to bog anyone down with those kind of things. But pregnancy should be a really joyous time. It should be a happy time. But at the end of the day, these are some of our realities in maternal health, and it's going to take all of us to get these numbers looking a lot better. All of us to make sure that no pregnant mama is lost, that no lives are lost, that there's equity on all factors of healthcare. So I want to end with the story of my high-risk pregnancy luckily, I've seen a lot of different high-risk pregnancies, and I've seen a lot of scary situations, and I will not say that mine is the scariest I've ever seen at all. But to be in it as the patient was very eye-opening to me. My pregnancy with my firstborn was not really complicated. It resulted in a emergency C-section, but besides that, everything was pretty low risk. So it was really surprising to me when my second-born, Russell, was having complications from the very beginning. He was measuring too small. I kept having to get extra ultrasounds because they were worried about his growth and growth restriction. And I ultimately ended up developing preeclampsia. I had come back from my baby moon with Christine and our husbands. We did a joint baby moon, which is super cute. But we had come back from the baby moon, and I was just swollen everywhere. My face was huge, my hands and legs, and I was only 29 weeks. And I was like, this is weird. It's kind of early to swell like this. And I thought maybe it's because I was walking around a lot and just really active on the trip. I used to start my prenatal care visits in the mornings and then see patients the rest of the day, since my own office was my OBGYN. And so I went in and was told, you have high blood pressure. You need to go over to the doctors, to the hospital. So I go to the hospital, and immediately I'm like, oh gosh, I hope I'm not developing preeclampsia, because preeclampsia, let me back up. Preeclampsia is a condition in pregnancy that can be lead to high blood pressure, liver, kidney dysfunction, and ultimately can lead to seizures. High risk, high complications of it can lead to like death, liver failure, stroke, and things like that. And literally, before I got admitted to the hospital for this, about a month before, another Black doctor, a Black pediatrician named Dr. Shanice Wallace, had passed from her complications with preeclampsia. And this literally rocked the healthcare community, just because, of course, we see a lot of complications, but, just the fact that this can happen to somebody who looks like me, who could have been me, it was really frightening. So being in the hospital, kind of dealing with Russell's complications and my own blood pressure issues, there were a lot of times that I had lots of fears and worries, wondering what things may look like for me. Would I end up with severe complications that could take my life, or that could take me away from my husband and my kids? And of course, no, I was not focused on the worst of these things, but honestly, leaving the hospital by myself at first, because Russell was not there, but eventually with him coming home, I literally to this day feel so lucky to have him in my arms, so lucky to have him in my life, and lucky to have been taken care of so well by the staff at my hospital, my partners, and just feel like everyone had my back there. And those are the things that I want for every patient, that everybody deserves, to be able to say that they've had the best care, no matter who they are, where they are, what they look like. And so I have personally been there. And I know that there are a lot of mothers out there scared that this could be them. So what I want to say is, don't let these fears take away from the fun, exciting time that is pregnancy. And though these complications are there, think about some of the tips that I said today, just as ways to find comfort in that there's going to be a team out there to take care of you. You're going to have that support system. You're going to ask all the right questions. And as a community, we'll continue to work to improve these scary statistics for Black women and all patients out there. So as we end off Black Maternal Health Week, I just want to say that I am so glad that this is an opportunity for us to continue these discussions, and that I hope that all of you out there, continue to push us in the healthcare field to do better by you guys, and do better to support every single patient, no matter what we look like. All right. Talk to you again in 2 weeks, you guys. Don't forget to subscribe to our podcast so you don't miss a thing, and leave us a review. You can also follow us on Instagram at the Cradle and All, or email us at thecradleandall@gmail.com.